Hello, friends. Welcome back to the Test Those Breasts podcast. I am your host, Jamie Vaughn. I'm a retired teacher of 20 years and a breast cancer thriver turned staunch, unapologetic, loud supporter and advocate for others, bringing education and awareness through a myriad of medical experts, therapists, caregivers, and other survivors. A breast cancer diagnosis is incredibly overwhelming with the mounds of information out there, especially on Dr. Google. I get it. I'm not a doctor, and I know how important it is to uncover accurate information, which is my ongoing mission through my nonprofit. The podcast includes personal stories and opinions from breast cancer survivors and professional physicians, providing the most up-to-date information at the time of recording. Evidence, research, and practices are always changing, so please check the date of the recording and always refer to your medical professionals for the most up-to-date information. I hope you find this podcast a source of inspiration and support from my guests. Their contact information is in the show notes, so please feel free to reach out to them. We have an enormous breast cancer community ready to support you in so many ways. Now let's listen to the next episode of Test Those Breasts.
Well, hello, friends. Welcome back to this episode of Test Those Breasts. I am your host, Jamie Vaughn, and today I am super thrilled to have my guest, Paula Berry, on my show. So Paula is a licensed clinical social worker and has been practicing therapy for 26 years. She has experience in both the private and public sector. She specializes in complex trauma and also treats mood disorders, anxiety, and women's issues. She is a certified psychedelic-assisted therapist and has been practicing in the psychedelic space for 3 years. Paula, also a cancer survivor, and her own journey with rectal cancer and psychedelic healing continues to shape her perspective. She is active in the advocacy community and is hopeful that these medicines will become legal in the near future. Well, hello, Paula. Welcome to the show. I'm so thrilled that you're here. This is like a long anticipated conversation that we've been talking about. How are you doing today?
Hi, I'm doing great. Thank you so much for having me. I'm so excited to be here and talk about this
Me
very
too.
interesting topic.
Yeah, very interesting. I think people are really going to be intrigued by it. Well, to start off with, what I would like to do is to kind of go back into who Paula is. Can you start by telling us a little bit about your journey, not just as a therapist, but as a colorectal cancer survivor?
Sure. Well, as you know, I've been a therapist for 26 years, and I am a certified trauma specialist and work with a lot of different kinds of trauma, and in particular, complex trauma, treatment-resistant depression, mood disorders, women's issues, anxiety, things like that. All of those things that go along with having cancer. And when I was diagnosed with cancer in 2023, I was very shocked. There's no family history of colorectal cancer at all. And I had missed a routine colonoscopy. I was due for a 5-year follow-up because I'd had polyps in the past. And I was taking care of my terminally ill brother, and it was also during COVID. And I just overlooked that 5-year mark. So about a month after my brother died, I started experiencing symptoms of colorectal cancer with rectal bleeding, which I just sort of passed off as maybe having hemorrhoids. I didn't have any other symptoms. I did have this weird rash that wasn't really responding to anything. So I think it's cancer related now in hindsight. But it's atypical for a rash to go along with colorectal cancer. But I will never forget the day I was diagnosed. I think everybody that's diagnosed with cancer remembers that phone call. And so I started treatment and went through radiation and oral chemotherapy. I had 28 rounds of that, and then a little break for a couple of weeks, and then did 8 infusions, and also had to take home the little wearable infusion device that I had to wear for 48 hours. And then after that, I had an MRI, which showed residual disease, which then led me to have a colectomy. And I now have a permanent colostomy. And as you know, later on, when my pathology results returned, there was no evidence of disease. So, in hindsight, not needing that surgery really sent me into a tailspin, and I
Yeah.
became very depressed.
I would to let my audience know, Paula and I actually have known each other for quite some time, and this cancer happened really like right after my breast cancer, and so
Yeah.
I had gone through all the trauma with my story with my breast cancer, um, situation, and then all of a sudden you're diagnosed with your colorectal cancer. And I remember how traumatic that was, especially after finding out that you really probably didn't even need that surgery. And so I can imagine what was going on in your head. And, you're dealing with clients and their trauma for all this time, and you've had trauma throughout your life. And then this
Yeah.
happens. And so it just kind of piles it all on. So what we do is we talk about it more, which is exactly what we're doing right now. So was
Yeah.
there a moment when you realized that this part of healing is not being talked about it enough?
Yes, I think throughout treatment, I realized that it wasn't being talked about enough. And in particular, colorectal cancer. I know this is Test Your Breasts, and I appreciate you having guests on that have different types of cancer. Colorectal cancer is one of the most increasing cancers, especially among young people, people under 40. And it's starting to be talked about more now. But there's also a stigma in regards to especially rectal cancer. Even saying the word rectum has a stigma, and talking about bodily excretions is taboo in our culture. And so there's almost this sort of feeling dirty when discussing colorectal cancer. And so that's part of the issue. I think the other issue, a conversation that I had with my oncologist about this, is that oncologists are trained to just manage the disease and try to eradicate the tumors. And that's what surgeons do, and that's what radiation oncologists do. And they're not trained in the psychological aspects, the emotional well-being aspect of navigating cancer. And he did say we have to do better, which is great, but what exactly does that mean? And
What
I
does that
do
mean?
think that, yeah, yeah.
So, my audience, some of my audience knows, and I have been on a navigation cohort with Nevada Cancer Coalition here in our area. And we have been looking at the cancer spectrum from education before diagnosis to treatment to survivorship and end of life. And we've been looking at where all of those gaps are. And there are a lot of gaps. And what patient navigators actually do in whatever space they're working in. So, this is something that I believe should be brought to the forefront and talked about more with even just our Nevada Cancer Coalition, and how we can actually fill that gap of the lack of mental health care, as this is a gap in pretty much all cancers. And I think that there are certain areas that are getting better because it is being recognized and it is being talked about, but it just needs to be talked about more. And especially when you're talking about cancers that, have that stigma, and using the term rectal. I mean, I was just having a conversation with somebody who works in policy when it comes to breast cancer, and you can't even use, it is said that you probably shouldn't even use the word breast
Oh
in
my
front of a
goodness.
panel of men who are making these decisions. Yes.
Wow.
Um, yeah, I just had a guest on, Sheila with BC Ruckus, who said she was actually told that she should probably not use the word breast, and she's like, "Well, how do we talk about breast
Whoa.
cancer if we can't even use the word breast?"
Yeah, that's very odd. That makes
Yeah.
no sense.
So we talk a lot about surviving cancer physically, but what
Yeah.
does emotional survivorship actually look like, Paula? Because I know we've talked about this many times, but what does it look like?
I think that it looks like getting support. It looks like, again, finding community is so important, just in general, but especially in navigating cancer. Understanding that it's not just about managing the actual cancer, the tumor, it's about being able to talk openly about what we're experiencing and having other people understand what we mean when we talk about treatment side effects, limitations that happen, permanent body changes for some of us, and what that means for us and our lifestyle. And it means no shame, no shame in our experience, no shame in being able to say, I don't know if I can do this. I don't know how to do this. I'm feeling hopeless. I think there's a lot of toxic positivity culture surrounding cancer and cancer survivorship. And I think that although people are quite well meaning, it can be harmful and make things more difficult when we insist that people find things to be grateful for instead of really honoring the pain that they're in and their fear and their uncertainty.
Right. And I think obviously you and I both have experienced that toxic positivity, and this sort of nudge to get back to normal after we have gone through all of our treatment. But as
Yeah.
we both know, there is no normal, like getting back to normal. And you had
No.
mentioned earlier that you have an ostomy bag and you had to really get used to having that, because that's just not something that we ever think, oh, we can just get right into it and get used to it and it's no big deal.
Yeah.
And you can't really talk to anyone about that necessarily, especially if they have never had one, right? So when you say community, we have Cancer Community Clubhouse here with Natalie Stevenson, that you and I both know very well. And I always really try to let our audience know that it is important to find that community, because other people aren't going to understand. They're not gonna give you, they might give you compassion, but they're not really going to, um, truly understand what you're going through.
Yes, that's absolutely true. And there are Facebook support groups that have been tremendously helpful. But one of the things that can be difficult about that is when, sometimes people are experiencing worst case scenario. And so it can be a little bit scary to hear all of the horror stories. But it can also be quite helpful. And there are many, many people who have been dealing with cancer and or in my situation, ostomies for a very, very long time that have a lot of tips and tricks that the medical establishment doesn't have.
Mm.
And I found that to be just really life-saving. And for me, too, luckily enough, I am able to irrigate my ostomy, which means I don't have to wear a bag 24/7, but I did for a year. And that was one of the hardest transitions that I've ever had to experience in my life, especially being a therapist. I sit in front of people all day long. And losing that bodily autonomy is a really, really big deal. And colorectal cancer is not the only cancer in which people experience loss of autonomy and agency in some ways. And so, again, finding community, finding support groups, finding people that know what it's like, finding people that have ideas that sometimes although ostomy nurses are amazing, and I think everyone that I dealt with in the in my treatment and in my survivorship has been amazing. Finding people that share your experience is also very important, and you don't have to navigate this alone.
Well, and I think that's a really important point to make is that I think that the medical community and even the researchers are finding more value in patient advocates. I'm a patient advocate for breast cancer. There are patient advocates out there for colorectal cancer and other cancers. And I think that they are finding more value more and more because they are the bridge between the patient and the medical community. And
Right.
so we are the ones who are letting the medical providers and the researchers know, hey, this is what patients are going through. This is what they need. And we know it's working because we see things popping up like nurse navigators at even cancer care specialists where I go. There wasn't a nurse navigator there when I went there. And now there is because people are more and more talking about, hey, we need a navigator there. We need somebody who can deal with the mental health of these patients as well. Because you're right, the doctors, they're there to save your life.
Right.
There's some of them who are really good with the mental health piece, but there are some of them who are not. So very
Right.
good point. So I want to get into anxiety and depression. How do anxiety and depression show up after cancer, and why do you think this piece is still so under discussed?
Well, that's a really great question. And I think that it shows up a lot of times afterwards for a couple of reasons. One, because when we're in treatment, we're really focused on treatment and getting to our chemo appointments and getting to our radiation appointments and taking our medications and whether we can work or not work. You know, we're sort of in survival mode. And that's not to say that people in treatment don't get depressed because that does happen or get anxious because that does happen. I think what we don't talk about enough is when treatment is over and there's this
Mm,
expectation that we're going to get back to our old self and our life is going to go back to normal, especially if we have successful treatment outcomes. There is an expectation that we're going to, get our old life back. And for many of us, that just absolutely does not happen.
mhm,
And so our nervous system starts to sort of come out of survival mode. And now, ooh, we feel all of the feelings that were sort of held at bay, perhaps when we were navigating treatment. And then now we're dealing with amputations, which we don't name. And so I name colectomies and mastectomies and other types of surgeries where body parts
mhm,
are removed as amputations because that's what they are.
mhm.
And they have a
Yep.
profound impact on our self image, again, on our bodily autonomy and how our bodies work. And when we don't expect these things to be happening, they impact us more heavily. And so it's recreating our lives. There's no normal to go back to. That doesn't happen for most people, especially if you've had an amputation of some sort.
Mm,
So it's creating what my life is going to be like now or into the future. And that is something that nobody talked to me about when I had cancer. And so trying to navigate that on my own was very, very difficult. And thank goodness I have an amazing therapist who was my therapist before I had cancer. And so I was able to continue to have that resource, plus Cancer Community Clubhouse. I love them. Giant shout out to Natalie and all of the people
Yes.
that make that place keep going. That is a wonderful
Yeah,
resource
because
that we have here.
Yeah, because when Natalie got here, there wasn't one and there was nothing. I know she was appalled. So she had had an experience with a great community clubhouse and she came here and was like, we need something here. So having her provide that space is just amazing. And it is nice to have friends too who sometimes pop out of the woodwork. And then
Yeah.
sometimes those who have been there for us for a long time, like, you for me, and you do name it and you don't pussyfoot around, and just, with that toxic positivity. For me, I did have a couple of people to ask, say something about me, oh, you get a boob job. No, This isn't a boob
Yeah.
job. I
Right.
am it's an amputation, and it's not something that I have ever wanted anyway.
Yeah.
Yeah, so thank you for naming it, Paula. So, for people hearing this for the first time, what is psilocybin and why is it being studied in cancer care?
Psilocybin is the active ingredient in magic mushrooms, actually. And psilocybin is being studied in cancer care because the people at Johns Hopkins University back in 2016 wanted to see if it would help people with late stage cancer who were experiencing end of life anxiety and existential dread and confusion. And so they did a study and found that the majority of participants verbalized a significant decrease in that existential anxiety that they were experiencing and were no longer afraid of dying. And that is a really big deal for people experiencing end stage cancer and having to navigate leaving this planet and saying goodbye to loved ones and making arrangements and all of those things. And so we need to continue to offer alternative medicines to people. And I don't know about you, but not just in regards to psilocybin. I also participated in alternative treatments besides the traditional typical Western medicine. I did a variety of treatments, including chemotherapy and radiation. And I think that it's really important for people to have alternatives as they're navigating cancer and navigating survivorship. That being said, psilocybin continues to be illegal federally. It is only legal in 2 states, in Oregon and in Colorado. It did receive breakthrough status as treatment for depression and anxiety in 2018, and um, robust studies continue with pretty amazing results in regards to depression, anxiety, PTSD, and addiction. And, people like me are hoping that these medicines will become legal in the next couple of years federally. But if not, there are many, many states that have been legalizing psilocybin for the things that I mentioned. And also just in terms of letting your audience know, I am a certified psychedelic-assisted therapist and have been practicing in the psychedelic space for the past 3 years with ketamine. Ketamine is also a psychedelic medicine used for
Mhm.
depression and PTSD, and it's the only psychedelic medicine that's legal federally. But we're waiting for psilocybin and MDMA and LSD and other medicines to be made legal.
And there are a few documentaries out there in case anyone wants to watch any. What is the one that you had suggested that I watch? I can't remember the name of it, and I did, and it was amazing.
Yes, that documentary is called In Waves and War, and it's streaming on Netflix as we speak. And that is a great documentary showing how ibogaine, which is another psychedelic medicine, that's newer in the landscape. As far as the public goes, the people in the military have been using ibogaine to decrease PTSD symptoms for quite some time. You have to go to Mexico to get that treatment right now.
Mhm.
But that is a great documentary, and what it shows, which was no surprise to me, but will likely surprise many and did surprise the participants, is that they thought that their military trauma was going to be the main focus in regards to using the medicine. And what became evident was that it was their childhood trauma. And the more adverse experiences we have in childhood, the more stressors we have, the less support we have as children, the more we are going to be impacted by traumas later, traumas like cancer. And that is something that is really also really important to talk about as we talk about navigating cancer and having PTSD from cancer and depression and anxiety. The more unhealed childhood wounds we have, the more we will be impacted by a cancer diagnosis. And that is something that I haven't really heard anyone talking about.
That is that is so important and so fascinating to me. That documentary really actually was pretty life-changing for me because it was life-changing for them. You have grown men who come out of their experience with just a whole nother perspective of their whole entire world, everyone that's involved in their world. And I'd highly recommend anyone to watch that. So, what is it? Let's just go back to psilocybin for a minute. What is it about psilocybin? Because I think it's good to clarify that when we're talking about magic mushrooms, we're not talking about this isn't like a recreational type thing to do. Like people go out and hey, let's go shrooming. Can we talk about the difference between recreational use and use for therapy?
Yes, and thank you for asking that question. That there's a very, very important distinction between recreational use and therapeutic use. And I am not a gatekeeper, so I am not against therapeutic use or ceremonial sacrament use. Psilocybin is one of the safest uh, drugs out on the market. Its addictive potential is at the bottom. And also, there are very few side effects. It is a very, very safe medication. It's so safe that Oregon has legalized it outside of the medical model. But they still require, if you're using it therapeutically, they still require licensed facilitators. And when you're using psilocybin for therapy to treat depression or PTSD or anxiety, it's very, very important to get a trained facilitator and do good preparation and to talk about what could potentially happen, to temper expectations, to help people understand it is not a panacea and it is not going to cure your depression and anxiety. Psilocybin opens a window of opportunity. It allows our brain to be more flexible, otherwise known as neuroplasticity. And what it does is open up flexibility to invite change. So that neuroplastic potential lasts about 2 weeks. And during that 2 week period of time, it's really, really important to think about and talk about and get integration from trained professionals so that you can incorporate new ways of doing things into your life. So you still have to do the work. There is work to do. The psilocybin does not do the work for you. It opens up a window of opportunity. Psilocybin shows us things that, areas where we might need to make some changes. It can create ego dissolution for people, which can sometimes be disconcerting and scary. It can also be very blissful, but it can be very difficult for people have challenging experiences where they're having some anxiety in the medicine experience, or they're having some going into deep, dark places that maybe they haven't navigated before. And there can be a lot of grieving happening, a lot of sadness happening. Sometimes, like I said, fear can happen. And it's really important to have somebody that knows what they're doing to help
Mhm.
navigate the experiences. And most importantly, after the medicine experience, to continue to work with somebody and do that integration. The research is showing more and more that integration afterwards and preparation beforehand is really, really important in order to get the benefits of psilocybin or any other psychedelic medicine. And the other thing is, when you're going into a psilocybin journey, part of the preparation is setting an intention. What do I want this medicine to show me? What do I want to know about myself? Um, if I'm having a stuck point, for example, I'm stuck in this sadness and I have this deep sadness and I can't identify where it's coming from. I'm going to ask the medicine to show me, what is this about? Or if I'm not sure where to go from here, my intention might be just to be open to seeing, where do I need to go from here? What do I
Mhm.
need to know about myself? that maybe I don't know. Or maybe I need to know it differently from a different perspective. So, as we set intention, it can be really helpful sometimes to have a professional help us with that so that we can understand going into the medicine. This is what I want to get out of it. These are the questions I'm asking. And whether you believe that psilocybin is simply a Western medicine model or you have a more spiritual model, um, there is some reverence for the wisdom of the medicine and activating our inner healer to sort of show us what we might need to see. But that preparation and integration is really, really important in that intention setting.
And this isn't something that you do like once a week. If somebody chose to explore this kind of therapy, and I first I want to talk about the type of therapist you talked about, somebody who is licensed. There are good therapists and not so good therapists. What is your advice on choosing a therapist, an appropriate therapist, a safe therapist? What's your advice on that?
I think that's a great question. I am a firm believer in doing some consultation before you decide on a therapist and having some questions, asking them what is their perspective. Do they have a relational perspective, which means do they honor the relationship between client and therapist? Do they use cognitive behavioral therapy only, or are they trained in other modalities? How many tools do they have in their tool belt? And whether you know what those tools are or not, it can be important just to know that a therapist is trained in a variety of modalities. Trauma is a specialty, and many therapists will say that they're trauma trained or they're trauma informed, when in fact they have not been trained in the different modalities that are necessary. We used to think that you had to tell the story, and that is a cognitive behavioral approach. And what we know now is that you don't ever have to tell the details of a trauma story in order to heal. And as a matter of fact, talking about it can sometimes re traumatize people. So it's really important to know going in, I get to choose what I talk about and what I don't talk about. And my therapist isn't going to try to force anything that I'm sort of as a therapist, I have tools that I offer. I offer my calm, I offer my caring, but the client gets to decide what they do and don't want to talk about. That's very, very important. And having a conversation and just getting a feel for that therapist. I'm also a firm believer in therapists having a therapist. We have to do our own work. If I'm asking a client to go to a place that feels scary, I sure better be willing to do that myself. And if I'm not willing to clean my own house, so to speak, I certainly can't ask another person to be willing to clean theirs. So those questions can be really important for people going in.
You've got to walk the talk.
Yes, absolutely. You got to walk the talk, and you can't be afraid to ask questions. The whole days of the therapist kind of being a robot on the other side of the room and not being willing to share any personal information, or, we are human beings first. And yes, we must have boundaries and ethics. Those standards of care are very, very important. But we also get to honor our humanity and that we are in a relationship with another human being. And that is really, really important.
Yeah, and you have to feel safe with that therapist. I'm very lucky to have my therapist, Terry Ann Harrison, and I actually started seeing her right after my diagnosis, and I was lucky to get into her, and we've been seeing each other ever since. And I still, to this day, we see each other at least once a month, and she has been so helpful on not just the cancer front, but all kinds of other things ever since. And so she is my safe space and I really trust her. And I would argue to say that she's been the best therapist I've ever had. And I've had several. And I do think it's really important for people to know. I really believe that anyone who is diagnosed with cancer, um, among other things, of course, would really benefit from having a good therapist, for somebody to talk to, especially if they have some sort of experience with cancer patients. And I knew that Terry Ann did. Anyway, that's just my 2 cents on it. I've just gotten a lot out of it. And so I would love to be able to connect that psilocybin to cancer. So what surprised you most about the experience that you've had, and how did it change your understanding of your own cancer trauma?
Yeah, I've used psilocybin several times in regards to healing many aspects of my life, but also cancer. And one of the things that profoundly impacted my ability to heal was the psilocybin really showed me, losing, my colon was very important to me. And losing my
It was
colon right, and my rectum was in fact an amputation. And when I had that surgery, they just took out my colon and threw it in the trash, and nobody talked to me about the emotional trauma that this would create for me, and how important our colons and rectums are to us in our everyday lives. And I had to grieve the loss of that body part, and I had to grieve the loss of bodily autonomy. And the psilocybin just really helped me articulate that in a very specific way and allowed me to grieve without shame and embarrassment, that I got to love my colon, that I got to love these parts of my body that I no longer had. And that was profound for me. And also, one of the things that psilocybin often shows people is that there is so much love as well. And there is so much connection out there for us. And we have to remember that that exists for us, that we can be connected to love regardless of your universe or your religious or spiritual beliefs, that love and connection is available, whether that is to a higher power or to a god or to other human beings. Psilocybin really helps us remember who we are, and that is that we need community and connection, and it is available to us if we reach out for it.
Yeah, I was just talking to someone the other day about her friend's breast cancer, and her friend has just never recovered. She used to be this very vibrant person that everyone knew, and apparently she is not that way anymore, and she's very depressed, has a lot of anxiety, doesn't have the will to be out there like she used to. And I think about people like that, about the psilocybin or any kind of alternative type medicine would be able to possibly open up a different world for her.
Yes, and the potential is definitely there. And does it work for everyone? No, it does not work for everyone. And not everyone is even eligible to participate in psilocybin therapy. And that's really important to talk about too. But just knowing that there is a potential for healing for someone and there's no access to it, largely because of the stigma surrounding LSD and magic mushrooms and other psychedelic medicines. The war on drugs really did a number. It worked. It
Mhm.
was very effective in scaring people. Um, and psilocybin for most of us is quite harmless. So yeah, I think about that all the time. There are two organizations here in Northern Nevada. One is Sierra Psychedelic Society, and they offer a lot of educational groups. They have integration groups several times a month. And then there's the Nevada Coalition for Psychedelic Medicine, and they're an advocacy group, and they are fighting hard, hard, hard to get psychedelic medicines legalized here in the state of Nevada, especially for treatment for trauma and depression and anxiety and addiction. There are some amazing people in those two organizations who are just doing tremendous work. to try to make these
I,
therapies
I'm
available.
I'm really glad that you said that because I would like to put that in the show notes in case people want to, find out more, do some research, even get involved in that policy work,
Yeah.
because that's a really good call to action for us. Yeah, I love that you are so connected to that community because I've certainly learned a lot. And I'm just so glad that you were willing to come on here and talk about it because especially connecting, psychedelic medicine, in particular psilocybin, with cancer care. I do believe that there are some people who just pop right out of it, or they, at least they look like they
Yeah.
do, just pop right
Right.
out of that cancer journey and they just move on with life and they have no problem. I know that the February after my treatment and two of my main surgeries, I went into a pretty deep depression, mainly because, well, first of all, because of cancer and you're not that's the other thing is that you have all these treatments. You're going to the doctors over and over and over and over again.
Yeah.
And then all of a sudden you're not going to the doctor anymore and you don't have these people caring for you. So you're sitting at home with no one caring about you. And so that was part of it. The other part is that was my very first year of retirement. And so when you're so busy for years and years and you have this schedule of things that you're doing, and then all of a sudden that's not there anymore. You're kind of like, well, what the fuck do I do now? I don't
Yeah.
even know what my life is even going to look like now because I had all these other plans before I retired. And then I got cancer. And then all of a sudden I'm in this suspended space of who am I? Like, why am I'm not even significant anymore. What do I do? I am the type of person that takes the bull by the horns and says, all right, what do I need to do to help myself? And so that's why I started this podcast. It really truly was as a healing mechanism for me personally to have conversations with other breast cancer survivors, patients, medical providers, therapists, because I needed that. But
Right.
then as time went on, I realized, oh my God, like, this isn't just healing for me. This is healing for so many other people. So
Right.
that was my modality. But then I've always been into alternative medicines. I have,
Right.
just really always been open to that kind of healing and medication in the first place. So psilocybin, it doesn't surprise me that I'm all for that, and it should be legalized. So, to my audience, whatever area you're in, hopefully there's some advocacy groups out there where you are. But here in Northern Nevada, we will put those sources in the show notes for people to get involved. So, thank you for that. And I just would like to know if you have anything to leave us with before we disconnect today.
Well, I think that the main message is, again, just advocating for these medicines. I encourage people to do their research. Johns Hopkins is a big player in the psychedelic, especially for cancer care. Also, but research is going on all over the place, and you can look up clinical trials. If you're interested in participating in a clinical trial, there are clinical trials ongoing all the time. Stanford is doing research, UCSF is doing research, Berkeley is doing research. So the research has expanded tremendously, which is so important.
Mhm.
We have an administration that has cut research into treatment for cancer
Mhm.
care, which is tragic. And psilocybin is one area where actually research is amping up. And I'm very hopeful. And because depression and anxiety impacts cancer survivors so profoundly, you can look up the research, not just for cancer, but for depression and anxiety, because that is
Mhm.
relevant. Even when it's studied separately from cancer, it's still very relevant research. So I encourage people to start looking things up if you're curious. Find a psychedelic society near you, see if your community has one. Look at policy and see what's happening. Understand the safety parameters in regards to psilocybin use, and maybe if you have been impacted by the drug war, maybe look at some more realistic paradigms in regards to psilocybin and see if you can maybe start to deconstruct some of that fear that was instilled in us, those of us that grew up during that time. My own psychedelic use started during adolescence, and I have used psychedelic medicine throughout my life, recreationally and for healing purposes also, not just for cancer, but other areas as well. And so I just encourage people to be curious.
I like that. And I love that you said that there's a lot of research that shows how psychedelics has been able to greatly improve people with depression and anxiety. That is a big deal because our society has far too many people that suffer from depression and anxiety. So thank
Yeah.
you. Thank you for this wonderful information. Thank you for your expertise. And to my audience, I really appreciate your joining me and Paula for this very important conversation. And we will see you next time on the next episode of Test Those Breasts. Thank you and bye for now.
Thanks for having me.
Friends, thank you so much for listening to this episode of Test Those Breasts. I hope you got some great, much needed information that will help you with your journey. As always, I am open to guests to add value to my show, and I'm also open to being a guest on other podcasts where I can add value. So please reach out if you'd like to collaborate. My contact information is in the show notes. And as a reminder, rating, reviewing, and sharing this podcast will truly help build a bigger audience all over the world. I thank you for your efforts. I look forward to sharing my next episode of Test Those Breasts.